Hey everyone. So in this PowerPoint, we're going to talk about how to raise a newborn puppy or kitten, all the do's and don'ts and tricks to keep these poor little guys alive. So before we dive into how to take care of the newborns, I'm just going to give you a quick little blurb on the bitches and the queens of puppies and kittens and basically how important their nutrients is. So of course, if they are underweight, we're more likely to see developmental abnormalities such as cleft palates, any sort of underdevelopment, which could be anywhere from hernias to undeveloped digestion systems. Um, or even they might not make it to birth in the first place, and mothers are likely to abort or give birth to dead fetuses. This also can happen if the mother has too much nutrients. So it's key to understand that you can overfeed a pregnant dog or cat. And this can happen due to too many vitamins or minerals. We can end up with cleft palates again, skeletal abnormalities, and other birth defects that can affect these poor kittens and puppies' survival. So just for clarification, neonate is considered a puppy or kitten that is below the age of 6 weeks. So this is very critical time for them, especially if they're orphaned. So it's really, really key to understand what their mother does for them so that we understand what we need to be doing for them to raise them without their mother. So obviously she's giving them full balanced nutrition with her milk. It's not just milk we get at the store. It is a full balanced nutrition, which we'll go dive into later. She also, in this milk, provides them with their own immune system. That is not something we can do again with milk from the store. Mom also provides a continuous source of warmth. The whole litter does this. A very key thing, which we'll also dive in later, is mom and the litter provides socialization and bonding, and that is huge. She also has to help them urinate and defecate. So we have to remember that we have to do all of these things. It's not just about feeding them. We have to provide a full, continued support that the mom would provide. So this is probably the most critical slide for you to consider and kind of stop here and think about it, especially if you have a newborn puppy or kitten. You really need to stop and consider this slide. So it takes a lot of physical and mental energy to take care of these newborn puppies and kittens. So you need to really mentally and physically prepare yourself. Are you ready for this? If it is a newborn puppy or kitten, they will require a feeding every single 2 hours. That includes through the night, or they will not make it. It also requires you taking meticulous attention to how you are mixing their formula, what type of environment are in, what's their temperature, what's the room temperature. These are all critical for their survival. You will want daily note taking where you're going to want to take down their weight, you monitor and write down their urination, defecation, what it looks like, calculating how much they're eating. It's going to continuously change based off their weight daily, and also the temperature, everything like that. This is also going to help give you red alerts when things are starting to make a turn for the worse for these puppies and kittens, because often by the time we physically notice it, it's too late. So the note taking is very helpful. You also have to be ready and know how to introduce socialization for these puppies and kittens when they're ready. So this is something you need, all these things you need to consider. You also really, really need to be prepared that you may lose this puppy or kitten, especially if it's your first time taking care of these guys. They are very vulnerable at this young age. And so you need to be ready that no matter how hard you try and how much you care for them, they might not make it. So one of the major things newborn kitten and puppies get from their mom is their first milk, which is colostrum. This is not the same milk that they produce throughout the rest of the time that they're nursing. It is only produced within the first 24 to 72 hours. And it is absolutely critical that these babies receive this milk because this is, again, it's not normal milk. It has extra nutrients in it. It's got growth factors in it that really, really help them within those first few days of life. It helps them with digestive enzymes. So those digestive enzymes help them digest milk, build their intestinal tract exactly how it should be. It's got those key nutrients. It's got immunoglobulins. That is huge. That is these puppies and kittens' first immune system. So it's their first defense. If they do not get this, they have no immune system. It makes them extremely vulnerable to getting sick from any sort of bacteria, viruses, things in the environment that they normally wouldn't get sick from. So it's critical that these guys get this milk within the first 12 hours of life. Because interestingly enough, what actually happens after 12 hours is their intestinal tract actually even changes, that if you were to feed them the colostrum after that 12 hours, they wouldn't be able to absorb it like they would within the first 12 hours of life. So it's very, very unique. This is key to understand when you have a newborn litter where there's one that's not doing very well, it's not suckling very well. So what that could mean is, even though that neonate did eat that first milk, might not have drank as much as he should have, because that milk is very, very, very thick, because it's so dense with all those nutrients in it. So if he's already weak, it might be hard for him to swallow that. So even though we watch these little guys drink, if he didn't drink as much as the rest of his litter mates, he might not thrive as well as the rest of them. So again, just to reiterate in this slide, without receiving that first milk or that colostrum, they are extremely vulnerable just to survival in general, just because they aren't going to have the nutrients, they aren't going to have the digestive enzymes, they're not going to have the growth factors, they're not going to have the immune system to help them survive in the environment. So again, if they don't receive that first milk, even if they're doing well within their first few weeks, it's really not considered that they are in the clear until at least 2 to 3 months of age. So if you've made it this far and you decide you do want to take on taking care of a newborn puppy or kitten, here's a list of things just to be ready to have. So obviously we do want a safe area that's clean and warm. It's often good to have a small space like a playpen or a box. Even though these guys are little and they're not very mobile, they can crawl around pretty quickly in a couple hours, and you can have a hard time finding them, and they can get pretty cold pretty fast. So you want to make sure they're in a contained area where they can't climb out. Again, you want to have that notebook for daily charting. It's really good. Go out and get a gram scale. This is going to be your best way to know how much to feed them and how they're doing. You're going to weigh them daily. It's good to have 3-layer bedding. You want the bottom layer to be a non-absorbable. A good trick somebody told me was just to go out to the dollar store and get a shower curtain and have that be your bottom layer. You want that second layer to be absorbent. So this could be newspaper, puppy pads, anything like that that's going to absorb moisture. And that top layer, of course, is going to be a nice comfy blankie. We definitely don't want it too bulky or any strings or anything coming out that the puppies could get their legs tangled in or swallow pieces of and get them stuck in their throat. A thermometer is critical. If I had to say 2 things that are critical, it is the gram scale and the thermometer. You absolutely need both of those. You also need a room thermometer, and it is best too if it can check humidity. You absolutely are going to want unscented baby wipes. Remember, mommy's not there to clean them with her tongue, so you're going to be doing this with baby wipes. Your milk replacer, the best ones are KMR or Espilac. I know my clinic carries them. I'm not sure if all clinics carry them, but those are the ones. I think you can find them in most pet stores. Also, if you're feeding tools, obviously, so you're going to need bottles with nipples and syringes, and make sure if you do nipples that they're small enough for the neonate. So we're going to focus on 3 primary areas. That is keeping them safe, keeping them warm, and obviously fed. So we'll dive into all of these in great detail in the rest of the slides. So room temperature is critical for these guys. Remember, they are tiny, tiny, and normally they'd be nice and warm since I'll go them next to mom, but they don't get that. So especially if they're an orphan, that first week of life, we want that 85 to 90 degree temperature. When they're 2 to 4 weeks, you can drop that down to 80 to 85 degrees. And at 5 to 6 weeks, we want 70 to 75 degrees, so more of that normal room temperature. Humidity is best at 50 to 60%, but if you do have a sick neonate, You actually, it's better if you have a higher humidity, up to 85% would be best. So just reiterating some environmental do nots. Remember what we discussed earlier, the bedding, we don't want it too bulky. You still want them to be able to ambulate around. And we do want it free of any loose ends or strings or anything that the pet might accidentally suckle on or get their little legs tangled in. We also, again, want that room temperature to be at the chart I just showed you. Otherwise, these guys can get too cold very, very quickly. Remember, stress is huge in babies as well. This goes for human babies too. We want this room to be quiet, especially in those first 2 weeks of life. If you think about how a mother dog would be, she's always trying to make her bed in a nice quiet area, and she doesn't usually like a lot of visitors. So you want to keep that room quiet. You don't want to let other dogs or cats in there. I would avoid having little kids in there, anything loud around them. They want to feel that nice, safe room. Um, Again, we want them in that nice safe box or playpen those first few weeks of life so they can't crawl out of the safe environment or the warm area. And 3 to 6 weeks of age, you can obviously give them a larger area once they're wanting to go explore and play a little bit more. Biggest thing is keeping it clean, absolutely clean. Especially a lot of these newborns, remember, we often don't remember if they got that colostrum or first milk, or we just don't know. We don't know because they were orphaned. So we want to keep that environment as clean as possible to prevent them from getting sick. It'll also prevent them from getting rashes and irritation by having moisture in their bedding and such like that. So you're going to need a lot of clean towels and bedding so you can keep circulating them for these puppies and kittens. Also, it's critical to understand too, just like human babies, you got to clean those bottles and those nipples between each feeding because there's a lot of bacteria that can live in there if you just leave all that milk residue and then just keep adding more milk replacer in there. So you got to clean between each feeding. This is where we talked about monitoring everything. This is where you're going to want that pen and paper. You're going to want to write down your day, your time, how much did they eat. Each meal, you're absolutely going to want to write down how much they ate. You're going to want to write down their temperature before they eat. We'll discuss how important that is later. You're going to want to weigh them daily on a gram scale. Again, they should be gaining weight daily. If they are not, something is wrong. It's good to write down what their suckle reflex. Is it normal? Was it less than the last meal? Is it more aggressive? This again is just, these are little things we can monitor to know how they're doing. Write down their eliminations. Did they go to the bathroom, urinate, or defecate? Remember, you're probably got to do this. You're going to have to do this for them. So even though you're doing it for them, write it down. That way you can see if it's going, like if they're getting constipated because it was too long since the last time you did it or the last time they actually went. You can write down any sort of developmental milestones. Oh, they're starting to walk around more. They're suckling more. They're really active, things like that. Also, again, any change in behavior. Do they seem a little bit more dumpy today? Are they crying? Anything like that. This will also help you if you decide to need to take them into the veterinarian. It's awesome to have all those notes already taken. They can browse over those and kind of give them a heads up where things might have went wrong. So why we monitor is very critical because it is the first sign that can give us when something's going wrong. We can often notice it if we're monitoring. We can notice it sooner than if we were just kind of mentally taking note every time. Because usually by the time we see that, it's when they have less energy, and we could have noticed it probably 2 days ago when we noticed they weren't gaining weight, or they just didn't have good a suckle reflex, or they had just a little bit less energy. So those are major things that something is going wrong. It is key to understand that sooner intervention rather than waiting a few days and seeing if they turn around, because often if you're going to try to wait those few days, it's hard to get them to turn back around. The sooner, the better. For the next few slides, we're going to go over proper weights for puppies and kittens, neonates. But it's key to understand that over 80% of the neonates that do die within the first 2 days of birth, they've been noted to have been born with a low birth weight. So that's critical note for us to understand, especially when we've done a C-section or we're weighing these puppies after mom had them, if the puppy is underweight compared to the rest of the litter, it's just good to mentally prepare ourselves to either pay closer attention to that puppy or, be understanding that they just might not make it. Again, I cannot reiterate enough, these neonates should be gaining weight daily. Go get that gram scale so you know if they are. So for puppies, their birth weight should be 1 to 6% of their mother's weight. A super easy way to do this is if the mom was a really big mom and she weighed 100 pounds, those puppies would need to weigh about 1 pound to 6 pounds at birth. Daily weight gain, so in week 1, they should gain 5 to 10% of their body weight daily. So again, that's going off the previous day's weight. Week 2 to 4, they're 3.5 to 6%. And then week 5 to 10, they start to slow down. It's about 2 grams per kilogram of adult body weight, which at that age we're not as worried about. But 1 to 4 weeks is most critical to pay attention. So in general, for kittens, there's not as much variability because there's not as much variability in the size of cats. But typical cat is going to be about 85 to 100 grams at birth. And then we do expect that they're going to get a daily weight gain of about 7 grams or about 100 grams per week. So we talked earlier about keeping the room temperature warm, and here's the reasons why. So newborns are highly predisposed to hypothermia because they aren't able to thermal regulate. So what that means is when we get hot, our blood vessels dilate, we're able to get rid of heat. When we get cold, we shiver and produce heat. Puppies and kittens are not able to do this. So they basically are kind of the victim of their environment. So we need to provide their body temperature by keeping the room to basically body temperature heat. They also can't shiver, which I just said. They can't shiver, so they can't produce body heat until these 3 weeks of age. They obviously have a low amount of body fat. They're babies. They haven't had a lot of fat storage yet, so they can't keep themselves warm that way. If their temperature drops, their digestion drops. This is critical. I'll emphasize this multiple times. And if their digestion stops, they get hypoglycemic, so their glucose or their sugar level drops, and they get dehydrated very quickly. And these puppies and kittens can go downhill very quickly when this happens. So here's just a quick slide showing their normal body temperature at these young ages. You'll notice it's really low. Again, that's because they can't maintain a good body temperature. So they unfortunately are, again, a victim of their environment. So they're going to be about 95 to 97 degrees if they're laying next to their mom, or we provide them with a nice toasty environment. When they get a little bit older, that'll rise up a little bit to 97 to 100. And then week 3, they're usually sitting around 100 to 102, which just is higher than human temperature. So just know that's normal. So this is probably one of the most important slides on this entire presentation. I can't emphasize this enough. We never, ever, ever want a neonate below 94 degrees. The reason of this is because their suckling and their swallowing will start to decrease. But most importantly, their gastrointestinal tract will actually become hypomodal, which that means it basically stops. So normally things are always moving through the GI tract. When they get below 94, everything just sits stagnant. So the unfortunate thing is these puppies and kittens will still try to eat at that temperature, but nothing's going to go anywhere. They're going to get constipated. They're going to get really sick. They're still going to get hypoglycemic even though they ate because they're not absorbing any of it. So it's critical to understand you do not feed a puppy or kitten whose temperature is below 94 degrees. So what do you do if it is below that and they need to eat? You're going to slowly warm their temperature back up. And we're going to do that by their environment. Get that room temperature back up. Get their heating pads back underneath them, which we'll talk about heating pads later. So we're going to slowly bring that temperature back up. And when they are above 94 degrees, we can give them their food. Again, record all of this in your handy dandy little monitoring notebook. So other than keeping just the room temperature warm, we obviously need to provide them with other heat. The biggest thing is that they do not have direct contact. So if you are using a heating pad, any sort of heating source, we need to make sure that that cushy layer is on top of it, and they're not directly touching it. They can get thermal burns really easily. So we want to make sure it feels nice and warm, so make sure your hands are contacting it. It feels good to your touch, and that they can move away from the heat source if they're getting too hot. So again, we need that bedding to make sure they're easy to walk around. So we want them to be able to move away from it, but still to an area that's not cold or cool, but just warm. Also, so you have to be careful with heating pads because heating pads can get very hot. It's recommended to actually tape them so that the setting doesn't actually get turned up too high. And again, we don't want to layer the entire bedding with them, just in case they do get too hot. They do need to move to a little area where they can cool off a little bit. You can use warm water bottles. There's heating discs, or there's microwavable heating pads, things like that you can use. Again, caution with heating lamps. Those can get really hot and it can be hard for them to move outside of them. So just be cautious. So feedings, so you're going to want to maintain a routine feeding schedule. We'll go into more detail about how we can start weaning them down to lower feeding intervals. But again, every 2 hours for that first week of life. No matter what milk replacer you're using, just make sure you follow the instructions closely. Don't try to dilute the milk anymore. Don't try to thicken it anymore. Use exactly what they're recommending, and make sure you throw it away within the recommendations after making it. Usually it's 24 hours. You're going to refrigerate it and throw it away after 24 hours after mixing. That's the most typical. You're going to want to warm each feeding up to 95 to 100 degrees on the stove, not in the microwave. What's going to happen in the microwave, it's not going to warm it all the way through. You're going to get that weird film on top. So that weird film is also going to hold a lot of nutrients with it. So a lot of times people like take off that film and throw it away. No, we're not going to do that. So we're going to warm it up on the stove to 95 to 100 degrees. And remember, we're going to record everything. Record what time they ate and how much they ate, how they suckled. So the best way to feed is with a syringe or a bottle with a nipple. This again is going to work only for puppies and kittens that do have a suckle reflex. If they don't, you're probably going to have to tube feed. I wouldn't recommend tube feeding if you've never done it before without the assistance of a veterinarian showing you how to place the tube. I did put a video on here, but again, I don't recommend you doing it at home if you've never done it before. At least get the guidance of your veterinarian to help you for that first time, so you know that you're not accidentally going into their lungs and basically drowning them. So it's critical, like, oh, not oops, I just put down the wrong tube. Like, no, you could kill them. So make sure you have the tube placement correct. So I have all this information also on a separate document, so you guys can print this off. And if you have trouble calculating these, you can also contact your veterinarian and just say, hey, this is their weight, this is their age, how much should I be feeding them? But this is just some guidelines. So for puppies, they're gonna need about 10 to 20 mLs per feeding for the first week of life. Again, there's a lot of variable there based on, are we feeding a toy Chihuahua or are we feeding a Mastiff? So it's gonna make a big difference. So another calculation we can do is this 240 kilocalories per kilogram per day. And then you divide that out between the feedings every 2 hours. So you divide it by 12. That's that first week of life. And then after about 2 weeks, you can slowly wean down to 4 times a day. But you're not going to do that dramatically. You're going to slowly wean them down to 4 times a day. So kittens are going to get about 4 to 5 mLs per meal per 100 grams, which is typical birth weight for a kitten. Again, this is why that scale is so critical. So 20 to 26 kilocalories per 100 grams per day is about roughly what that comes to. And again, we're going to feed them every 2 hours for 2 weeks. And then again, we'll slowly wean them down to every 4 to 6 hours for kittens. So everybody's tempted to feed puppies and kittens like we feed a baby, put them on their back, let them suck the bottle, hold them in all these different positions. No, We do not want to do that. We want to feed them as if they were nursing from their mom. This is the best way to prevent them from aspirating and getting pneumonia. So we want to make sure that we're feeding them like their mom. They'll often, a lot of times, they'll kind of preen like they do on their mother. So it's best to keep things as natural as possible for them. So we kind of touched base on all this, but we'll reiterate. So the best milk replacers to use are Espilac, KMR, Breeder's Edge, or Foster's Edge are two good ones as well. When you are using a milk replacer, you do not want to switch milk replacers. That can cause lots of issues. So just choose one and stick with it. You're going to want to mix as instructed on that milk replacer and warm to temperature. So we talked about that temperature, 95 to 100 degrees, via the stove and not the microwave again. Again, you only want to prepare enough that you're going to use in 24 hours, which probably isn't going to be a ton. Otherwise, you're going to end up going through a lot of milk replacer and wasting a lot because it often has to be thrown out within 24 hours. Again, store it in that refrigerator. So it's key to understand this because if this isn't followed properly, what you're going to cause is diarrhea or constipation in these young guys. And unfortunately, that can cause their death. These guys are very, very sensitive. They don't have a lot of energy stores. So something like just as silly as messing up the milk replacer and causing diarrhea, unfortunately, can cause them to not survive. So I hear this question all the time. What about just using raw cow or goat milk, or even their colostrum? The answer is absolutely not. It is not the same. Cats are not the same as goats. Dogs are not the same as the cows. Their milk is different for a reason because they have different nutrient needs. So cows and goat milk is actually low in fat, minerals, and proteins that is essential to puppies and kittens. And most importantly, there are two amino acids that are essential for puppies and kittens that aren't present in cow and goat milk, which would be arginine and taurine. So without those two amino acids, puppies and kittens, especially kittens, will form even kitten cataracts. And puppies and kittens will have poor growth in general and can even have heart defects. Cow's milk is also very low in iron. So we can see anemia in puppies and kittens if people try to use this instead of a milk replacer. Some things that can quickly go wrong when taking care of these little guys. It's key to make sure you inspect the nipple prior to each use because as you use these and they're gnawing on these, it can loosen the nipple end up. So you want that one drop at a time. If it gives too much, they can basically kind of drown themselves by aspirating too much fluid. Or if it's not giving enough, they get frustrated, they overuse their energy trying to get the milk out, and they don't eat enough. So this may sound silly, and I actually didn't know this for a while either, is that puppies and kittens need to be burped because when they're bottle feeding, a lot of times they will ingest air. So they actually do need to be burped. You can just do this by gently rubbing their bellies when you lay them on their back, or you can lift them up just like a little baby and kind of just tap them gently and rub their backs. And this will need to be done for the first 3 weeks of life. And also, do remember we have to stimulate them to urinate and defecate. And usually the best way to do this is just with like a moist little cotton ball and kind of rubbing their rectum and their genital area. I did provide a video on YouTube that I found that did a pretty good of demonstrating because he noticed he does not rub aggressively because you can cause a lot of skin irritation because you are doing this multiple times a day. So you're basically dabbing with a warm, moist cotton ball and then cleaning and drying them up afterwards. So this is the point we are all excited to get to is weaning. So by this point, it's about they're 3 or 4 weeks of age. You probably wean them down to about 4 meals a day now. And what we're going to want to do is just start mixing their milk replacer, making like a gruel diet. You can do this either with kibble or wet food, usually kibble, because that way you can transition to that more easily by removing more and more milk replacers slowly. You're going to want to use a lower shallow dish where they can't really fall in it. And also one that's not slipping around. You got to make it easy for them to access, not that's one that's sliding all around the floor. Also a key point is If they are an orphan, they might not be interested until they see another cat or dog doing it. So you might have to get them a friend that you can introduce them to that you know isn't going to hurt them and is disease free, to get them interested and curious in eating the new food. So we'll talk about some problem solving issues. So probably a term that gets thrown around a lot is fading puppy kitten syndrome. So what exactly is that and what does that mean? So this is a term that we use for neonates that just gradually just don't do well. They slowly kind of do a little worse and fade away within the first 2 weeks of life. So initially signs are very, very vague. It comes a little bit more obvious if they're in a litter where you can compare them to their litter mates. But if they're an orphan, it can be a little hard to tell. So this is where monitoring is key because often we'll see these neonates are failing to gain weight. They are less active. If there's a litter, they'll separate from the rest of the litter. And they also don't suckle as well as their litter mates. So again, this is why it can be hard to tell if they're not with a litter. But unfortunately, a lot of these kittens and puppies don't tend to make it. So there's a lot of causes of fading puppy kitten syndrome. So initially, if they don't get that colostrum, remember I saw how critical that is. That first milk is so critical. If they don't get that, we can see them fade away within the first 2 weeks of life. If they get dehydrated, their body temperature gets low or too high, or if their glucose gets low, so we're not doing those proper feedings. Also, if they have any birth defects that they're born with, or if they're born premature, which often means they're underdeveloped. They have a low birth weight. We talked about that earlier. Also, if they have any sort of other underlying diseases that's preventing them from gaining weight and thriving. Obviously, if they have any sort of bacterial or viral infection, these can really affect their survival. So unfortunately, there's no direct treatment. It's often just supportive care. And unfortunately, even you could provide the best care and some of these babies aren't going to make it. So again, the most common causes of death in these neonates, no matter what, is hypothermia, so that low body temperature, hypoglycemia, not getting that nutrients, a low birth weight, dehydration, which again, not eating, and failure to ingest that colostrum or first milk within the first 12 to 24 hours of birth. So just diving into understanding the hypoglycemia aspect a little bit more. So neonates don't have a good ability to store excess sugar or glucose within their bodies like adults do. We often have ample amounts of glucose storage within our bodies. Neonates do not have this. This is why that every 2-hour feeding is so critical. Neonates are 4 times more likely to die from a blood glucose lower than 90 if within 24 hours after birth. This is critical because a normal for adults is like 90 to 160, and we have diabetics all the time that will fall below 90 with too much insulin, and they usually do fine for a few days. But with these little young guys, they cannot do it. So it's absolutely critical to feed them every 2 hours. So just some problem solving with these little guys. Key to remember, if they are crying after feeding, something is wrong. They should be tired and sleepy. They should never be crying after eating. So one of the most common problems we'll see is their temperature. Make sure their temperature is not too low. Are they uncomfortable? So do you need to burp them? Do you need to help them with eliminations like urinating and defecating? That can make them very, very uncomfortable. So make sure you check those things. Also, are they hungry? Do they want to eat more? They're going to cry. Diarrhea is obviously a big sign too. The most common cause of diarrhea is overfeeding. This usually happens when people start weaning them down and we're trying to increase the volume between the meals. So if that happens, you need to slow down and go back to either the 2 or 3 hour feeding and decrease the amount of mLs they're getting. So you're giving the same mLs throughout the day, but you're spreading them out between more meals, so it's not as high of a volume, if that makes sense. And obviously, if they're underweight, they're not eating enough. So just to summarize this, the basic care is keep them warm. Key is getting that first colostrum or milk, if you're able to know if they did. Keep them clean. Keep their environment clean. Burp and stimulate them for urination and defecation until 3 weeks of age. So again, you have to be ready to fully commit to these guys. Monitoring is critical for that success, and you never, ever, ever feed a neonate below 94 degrees, and get consistent with your mixing, storage, and temperature of your milk replacer. So I absolutely wanted to touch base on socialization. This is probably one of the #1 things that people taking care of neonates overlook. And unfortunately, what happens is, especially with cats, is they can be raised and they can be very sweet for the first few months of their life. And then they can actually turn extremely aggressive, even towards the person that raised them. So socialization is critical, because it is heartbreaking to get these kitties and puppies to a point where they are surviving, and now they actually have no quality of life, because nobody can actually keep them because they don't have the social skills to make it a safe home for them. So the first 2 weeks, we don't worry about socialization, but as we get beyond that 4 to 6 weeks, it becomes very critical. So it's really nice if you are able to find other litter mates to expose them to. That makes it so much easier. If you can find another litter that you can expose the kittens to or the puppies to, that just makes it way easier from there. But if not, and you have to do home socialization, here are some key things. You never, ever, ever want to play with their hands. It might look cute and fun when they're that little, but this is when they turn aggressive, because they can see that you are the prey that they get to play with as they become full-grown cats and dogs. So never, ever play with their hands. Give them lots of toys to play with and redirection. So if they try to play with their hands, just always have a toy by you, and don't let them play with their hand. Just give them a toy and play with the toy with them. Don't let them climb on you. Tell them, ouch, and push them off you. Never, ever let them climb on you. Always have a stuffy. I've heard stories of people that say their cat or their puppy, now that they're full grown, they still carry around their stuffy with them. It's like their best friend. So, just let them, raise them with a stuffy. It could be their best friend for life. So 2 to 3 weeks of age, just start exposing them to toys. You can expose them to different people and environments and sounds. Again, make sure it's safe, because they're not vaccinated and we don't know if they got a good immune system, if we don't know if they nursed that first milk. 4 to 5 weeks, you can start crate training them more effectively in those bigger crates, getting them used to different textures of the floor. You'd be amazed at cats or dogs that have never seen grass, or they've been on carpet but never on hardwood floor. It really throws them off, and they don't know how to interpret it because they've never been in a different environment. So make sure we're getting their minds working, getting their textures on their paws and sensations used to things. Grooming's critical. Car rides, get them used to anything. Noises like vacuums. You can even, now with YouTube, you can play all sorts of noises, thunderstorms and gunshots, and just get them used to all sorts of things so that nothing's scary to them. And when in doubt, ask your veterinarian or local behaviorist. There's lots of information out there nowadays. Just please know it's easier to do these things when they're little. There's some things we can't undo, and not some things we can train or help them with after they are 3 or 4 months of age, because there's so much development in those young ages. But I do wish you the best of luck. Please let us know if you have any questions.